Okay. So when, as I said before, if it is going to be chronic pain, it will have different dimensions or multiple dimensions. One of it is going to be perceptual, that how a client perceives the pain. Even though we say we are going to administer all the pain scales, which are going to be objective measurement, it is not always possible to have a complete objectivity regarding pain, because everyone's perception about the pain differs. Now, there could be a similar kind of trauma, there could be two different people which will grade the pain in quality, intensity differently. Duration could be same. Okay, but the perceptual, I would say, makeup of the patient will make a lot of difference in case of chronic pain. Next is going to be affective personality or affective domain, which will include personality and emotional status. In this, what is the scenario like? Usually, if you see, there are type A kind of people who are always anxious. So their emotional state and their personality will have, or the people with such kind of personality will have different perception of the pain than the other types. So it will have is going to have an affective domain. Secondly, how do you weigh, what is your aim, or what is it that your person, if are you determined to achieve something or you don't want to do it? That also will come under affective pain. For example, people or athletes who are determined to achieve something will not think or make a fuss out of that pain. But at the same time, a person who doesn't want to work for it can have. So it will have an affective domain. And next is behavioral. Expression through communication and behavioral. That could include evincing, screaming, or also it can have behavioral like avoiding a certain kind of work, or doing some movement repeatedly, or pressing on. There could be n number of things that can come under behavioral problem. Now, if we consider pain anatomy, why do we perceive pain? Because there is stimulation of nociceptors. Now, nociceptors are found in interstitial tissues. What happens with this? These nociceptors are irritated or they are stimulated with extreme mechanical, thermal and chemical stimuli. And that's the reason why we perceive pain. Now, nociceptors found in vessel will also have this kind of phenomena. On top of it, it will have contraction or constriction and vasodilation. So this is how we perceive pain. Now, nociceptive fibers, which are the nociceptive fibers or which perceive pain or which carry pain sensation? Anyone? Which fibers carry pain sensations?
Ma'am, A delta and C
Ma'am,
fibers.
free nerve.
Yeah. Where do they carry this pain sensation? Is it dorsal horn of spinal cord, which will have a sensory column? Am I right?
Yes, ma'am.
So it's going to be sensory receptors or sensory pathways are always ascending pathways, that you all know. So it will carry it from the nociceptors, L delta and C fibers from the site of injury or the site of pain will carry the pain sensation to dorsal horn of spinal cord or dorsal column of spinal cord. Okay. Then what are the responses? If it is a pain is not that much, suppose somebody touches a hot vessel, what is the response? There is a withdrawal because there are smaller its other stimulus is weaker, not that strong, and at the same time immediately few motor neurons are firing, so you get a withdrawal response. Sometimes if there is a severe pain, then autonomic nervous system comes into picture. If autonomy is, if that's why people say the tooth pain is the worst, because what happens if it worsens, there are changes in the vital parameters. Similarly, after a road traffic accident, the immediate thing is also not only of taking care of the other hereditary and all, but also the pain perception. Because if the pain perception is higher, there are going to be autonomic changes which can prove or which can put the life in danger.